I don't see him. Let's give in another minute. Mahendra, check if Dr. Krishnan has joined. Mahendra, Dr. Krishnan is there or no?
Dr. Krishnan is not here.
He said he got your link and he's joining.
Well, he's going to speak late anyway, so you can.
Okay, so we can start?
Yeah.
Okay, so three things. One is, Mahendra, you do the recording, and then once you start Facebook Live and YouTube Live, you'll kick off in.
We are live now. Thank you. Good luck.
Namaste. Good morning from Boston. This is Kanchan Banerjee. I am one of the founders of the Boston Center of Excellence for Health and Human Development, and currently working as the managing director. Welcome to you all to this very, very unique event that we have organized today and tomorrow. And the special message for this event is that COVID-19 is probably a occasion to look back and look forward how our lives are going to be, how it has changed our lives. And it's not just COVID. Every era, every century has one or two such events, whether it's World War I or II. In this case, COVID-19 is a silent war, and we are all together in it, and we are fighting it, and we'll fight it off. And hopefully by summer, as Bill Gates says, that by summer, COVID will be conquered. But our lives have permanently changed in many regions, including our behavior, staying at home. We can see the nature is more beautiful today. The flowers, the air and the water are more fresh. The animals are coming out, birds are coming out. That tells us that we must have done something that caused them to hide. Now they're coming out. So hopefully this change will have some impact in our behavior, that nature is very important to us and we must protect. So that's a good message we get from this COVID era. The other message is that technology is here to play a major role in our lives. And it's up to us, the human beings, to ensure that technology doesn't manage us. We manage technology so that our lives are not robots. We are human beings, and we do the best to live our life and realize our potential. So with that, very few comments, we will move to the next segment, and we will start with lighting the lamp and having a special mantra that is being played today. As you know, a few days back, November 13th was the Dhanvantari Divas, and we celebrated the World Ayurveda Day. Dhanvantari is worshipped by all the traditional medicine people in India and worldwide. So let us light the lamp for great success of the event. Play, please. Thank you all. And now let me quickly just tell you who are there on our panel right now and what designation they have. First, if I see it the way I see it on the screen, Dr. Sadhbir Singh Khalsa at Harvard University, and then I see Dr. Dinesh Patel, again from Mass General and Harvard University. I will give his brief bio shortly. Mr. Randhir Jaiswal, our Honorable Consul General of India in New York. Then we have Dr. Bhushan Pattabardhan has joined from Pune. And then I see Dr. Balram Singh, the Chairman of Boston Center of Excellence Executive Board. I see Dr. Purnima. She is also part of the BoCE board. I see Dr. Sergio Suarez joined from Argentina all the way. Thank you. And I see Mr. Lam Pham. He is the Assistant Secretary to our state of Massachusetts. I'll introduce more. I think Dr. Patel is going to introduce in detail later. Dr. Darshan Mehta. He is also the board member of Boston Center of Excellence, and he is at Harvard and Benson Henry Mind Body Institute and Osho Center in Boston. And let's see, Dr. Bhushan Pattabardhan is there, but we don't see him. And then who else is there? Did I miss anybody? Dr. Krishnan is there?
Not yet.
Okay. So hopefully he will join soon. And with that, I hand it over to Dr. Dinesh Patel. And many of you already know Dr. Dinesh Patel. He's chairing this session. We are honored to have him. He's primary. First thing is he's the co-chair of the Boston Center of Excellence Advisory Board, and along with Dr. H.R. Nagendra at S. Vyasa. And he's former chairman of Board of Registration in Medicine for our state of Massachusetts, former board of director, Federation of State Medical Board, associate clinical professor at Harvard Medical School, emeritus chief arthroscopic surgery, ortho surgeon at Mass General Hospital. With that, let us welcome Dr. Dinesh Patel to chair this session. And just to mention, our honorable minister will be joining shortly, and then we will have him speak when he joins. Thank you so much. Namaskar. Dr. Patel.
Thank you so much. This is indeed a great honor for me to get involved in this wonderful globalized meeting run by BoCE. Mahendra, could you put my slides, please? Go from the beginning. So to begin with, I think as Dhanvantri has been quite the godfather of all of these, we have another godfather called Lord Patanjali. And this is quite fitting for us to have some invocation prayers from Lord Patanjali. Next slide, please. Let us bow before the noblest of sages, Patanjali, who gave us yoga for serenity and sanctity of mind, grammar for clarity and purity of speech, and medicine perfection of health. Let us prostrate before Patanjali, an incarnation of Odysseus, whose upper body has a human form, whose arms hold a conch and a disc, and who is crowned by a 1,000-headed cobra. Where there is yoga, there is prosperity and bliss with freedom. Next slide, please. Mahendra, next slide, please. Let us salute Lord Odysseus of the myriad serpent heads and mouths carrying noxious poisons, discarding which he came to earth. Okay, this is let us have greetings from our Guruji Nagandaji ji, the Chancellor and Chairman of Vyas University and modern godfather of promoting yoga, Ayurvedic and integrative medicine. The next one, please. Next slide, please. Our inaugural session will be Mr. Randir Jaiswal. Mr. Randir Jaiswal is an honorable citizen of India, New York. He has been, as I look at his bio, he has got a lot of accomplishment. The two which strikes me most to me is one, his interest in public policy as well as the climate change. He was involved in Brazil in climate change activity. One of the blessings we have as his wife is a doctor and is expert on public health. So welcome our Honorable Randir Jaiswal, and we can begin your speech from now on. Mahendra, please. Can we have Honorable Randir Jaiswal, please?
Am I audible?
Yes. Yes.
Good morning, everybody, and good evening and good afternoon, other participants. Honorable Minister of State for Ayush, Shri Shripad Naik ji. Am I audible? He little later. Good morning and good evening and good afternoon, other participants. Honorable Minister of State for Ayush, Shri Shripad Naik ji. Mr. Kanchan Banerjee, Managing Director of Boston Center of Excellence. Dr. Dinesh Patel, Co-Chair, Boston Center of Excellence Advisory Board. Mr. Namfan, Assistant Secretary of Business Development and International Trade, State of Massachusetts. Professor Balram Singh and all our distinguished guests and participants and panelists who have joined. We are delighted that this consulate, the Indian consulate in New York, is collaborating with the Boston Center of Excellence to organize this web conference on human health and humanity in the post-COVID era. You know, we all have been hit hard by the pandemic, COVID-19. It has got us to think hard, think deep as to how should we go ahead with our lives. Two things that Mr. Kanchan Banerjee spoke really struck me. One was somehow in the COVID pandemic, the nature seems to have gotten more space. They seem to be relieved. There are more animals in this space. Is this the way going forward? And second, the technology is here to come to shape our lives, but we should be careful that we should handle technology. Technology should not be handling us. Today, policymakers, doctors, researchers, scientists are looking for new avenues towards achieving human health for human well-being. In this context, integrative medicine, Ayurveda, yoga, traditional systems of medicine and traditional knowledge are being more talked about, are being more looked into. There is a renewed interest in Ayurveda, in traditional knowledge the world over, from Argentina to Europe to Australia and elsewhere. There is a lot more global conversation and thinking centered around these themes. On our part, on the part of the government of India, we are trying to promote traditional knowledge and systems of medicine as part of our international engagement. We want to share our knowledge with friends and partners abroad. We want to contribute to global public good in line with our thought of Vasudhaiva Kutumbakam, which means the world is one family. We are keen not only to strengthen well-being in our country, but worldwide. And in that regard, we are ready to share, we are ready to deepen whatever we have, whatever we've got from a tradition and culture. The COVID-19 pandemic has spotlighted focus on Ayurveda. There are a lot of clinical trials happening on repurposing some of the some of the drugs that Ayurveda has for boosting immunity. As you know, managing immunity plays an important strategy in COVID-19 treatment. All in all, there is a lot more global conversation. There is a renewed interest, and we must take it further, for it lies in everybody's interest to do so. On 13th November, we heard the celebration that we had the world over of Ayurveda. We celebrated Ayurveda Day here in Boston, here in the United States, in collaboration with Boston Center of Excellence. And such celebrations were held in each and every nook and corner of the world. I think when it comes to traditional medicine, we've come a long distance. There's a lot more understanding of what traditional knowledge, which has been handed down to us, to the present generation, from our ancestors for thousands of years. It's come down thousands of years. It traveled thousands of years. What it has, what sort of value it has to our lives. We had on 13th November, we had a workshop with Boston Center of Excellence. It was a lively engagement. There's a lot of learning in it, a lot of new things that are happening. We want to take that forward. I look forward to the lively engagement today so that we can really carry on with our global conversation on Ayurveda. Thank you very much for inviting me, and it's a privilege and a pleasure for this consulate to collaborate with Boston in this endeavor. Thank you very much.
The next speaker we have is no one else than our own Mr. Nam Pham. Nam Pham has been a wonderful person for us in the state of Massachusetts, economic development, and quite especially, we are proud to say that he has been very instrumental in developing good relationship with BoCE, state of Massachusetts, in India, and international relationship. So, Mr. Nam Pham, please continue the same relationship with BoCE and integrative medicine. So, can you please give us your thoughts?
Namaste. Good morning. Good evening. If I may say, if I may still can say, Happy Diwali. It has been for me one of the most enlightening celebration that I ever been able to attend to over the last few years.
Sorry to interrupt you, Mr. Pham. Your face is not fully visible. If you adjust the camera a little bit, we see only up to your nose. Yeah, that's better. That's better. Yes, yeah, thank you.
Good. So, thank you so much, Kanchen Banerjee. Thank you for having me. Thank you, Dr. Patel, for your kind introduction. And thank you, Consul General Yeswa, for your dedication working to improve our relationship between Massachusetts and India. And I'd like to congratulate Kenton Benri for having this wonderful discussion. I think it's very timely and very important for us to talk about post-COVID-19. Hopefully, post-COVID will come very soon. I've been asked to share with you a little bit about the relationship between Massachusetts and India. And I will also like to talk a little bit about our wonderful Indian American community in Massachusetts. I think I could say that the relationship between India and Massachusetts has never been better. And I could also say that the relationship between India and the US also has never been better. It has never been better thanks to the wonderful work of our Indian Americans, as well as our Indian officials, try to improve our relationship. If there is one silver lining of the COVID pandemic, I think it has brought all of us together. It has brought people who share similar values together, working together to solve the problem. We are all one family, just like the Consul General mentioned earlier. It also has helped us to realize who is really our friends and who is not such a good friends as we thought. So I think I could say that on behalf of our wonderful Massachusetts, I'd like to thank you for all of the contribution that our Indian American friends have made to Massachusetts. Over the years, we always try to improve our relationship. And I'm happy to say that it's getting better and better. For example, I personally have a number of times to visit India, both for business and pleasure. And our governor has met our consul generals from India, different persons, often. And just recently, he has a virtual meeting with Indian ambassador in DC. So I think that slowly and quickly, I hope, so slowly but surely, our partnership is improving. Last year, last October, we also had a Massachusetts delegation to visit Tamil Nadu to solidify our energy ties. I was not lucky enough to go, but it was a very concrete step to improve our partnership. And within Massachusetts, there are a number of Indian American owned and managed companies that help out help our economies as well. Company like eClinical Works, Talent Burst, Aqueduct Technology, and one of my favorite, Leader Bank, because I happen to be a friend of Mr. Sechil, the founder of Leader Bank. So we are very grateful for that. The Indian community in Massachusetts is one of the biggest Asian American community with more than 400,000 population. And our friends have brought not just prosperity to our community, to our state, but also has enriched our life with culture, with literature, with many things that we all cherish. One of the things that I always enjoy at the State House is the annual Yoga Day organized in the State House by our friends. And of course, I mentioned the Diwali celebrations. Diwali celebrations has been celebrated in different parts of Massachusetts, Boston, Worcester, Central Park, Western Park. The more people learn about Indian culture, the more people will appreciate how rich, how wonderful Indian culture has been, and also what kind of contributions that India have made to the world. When I try to say something related to this conference, I run into an article by a Stanford neurobiologist who just published an article called "Vision and Breathing May Be the Secret to Surviving in 2020." And let me read the headline for you. You may have a crack at it. The Stanford neurobiologist Andrew Huberman discusses the two things we can always control, even during a high-stress elections and scary COVID pandemic. And he has studied this for about 20 years. I kept smiling reading this because our Indian friends have known about this for thousands of years. We know that various breathing techniques have helped us to deal not only with stress, but to make our life much, much better. Therefore, I think that the conference is very timely, and it will help all of us to deal with the pandemic and many other parts of life. I hope that the result of the conference will be distributed widely, so all of us could be benefited from the Indian knowledge and wisdom and friendship. With that, I'd like to thank you again for having me this morning, and please contact the Office of Business Development if you like to know more about what Massachusetts government can do to help our companies in Massachusetts. Thank you, and happy Diwali.
Thank you, Dr. Nan. Purnima, will you introduce our honorable guest, Minister of Ayush?
Minister. I don't think Minister is here yet.
Oh, okay.
So we are trying to connect with them. Let's see. And in the meantime, maybe we can proceed to the next segment, which is Dr. Krishnan and Dr. Sergio.
So can I introduce Dr. Gita Krishnan? Is he here?
I'm here.
We don't see you though. Video. Okay. Now we see you. Thank you.
Yeah. Thank you.
We are so fortunate and lucky to have Dr. Gita Krishnan. He is, I met him last year in BoCE meeting, a wonderful man. At the present, he is working with the World Health Organization, promoting integrative medicine. And as part of the Integrated Health Service Department, is responsible for WHO's inclusion of our system in global healthcare and for the appropriate use of the devices by WHO's member states. This is an extraordinary honor for our own Dr. Gita Krishnan to promote integrative medicine globally. So welcome, Dr. Gita Krishnan. It's an honor for us to have you talk on your role at WHO in promoting integrative medicine. Thank you.
Thank you, Dr. Patel, for having given this very good introduction about me. Really nice, and thanks to you for that. I'm also thankful to the organizers of this conference for having invited me here because this is a very important conference, and I know that the kind of work you are doing are of great importance to the Ayush world across different continents, because everyone looks at what you are doing. So thank you for inviting me to this meeting. I would, with the permission of the respected Consul General of New York, I would. I understand that the minister has not joined, so as soon as the minister joins, I will refer to him also. Everyone else here, this is a great occasion, and the reason being, the COVID-19, even though it had been a big problem for the entire globe, for traditional medicine segment, it made a big difference, because as Dr. Bhushan Patwardhan always says, or had always been putting it forward as a perspective for us to understand, that this had given the opportunity for traditional medicine to be at par with the modern medical system. It has never happened in the past 250 years of its modern medicine's existence, and the kind of modern medicines, the administrative hold over resources. It never has happened earlier in the past 250 years. So this is the first time that it has happened. And now there has been, based on this particular perspective, there has been a lot of work happening across the globe. I can mention about Africa, I can mention about like China, and I can definitely mention about India and other countries like Sri Lanka, Bangladesh, etc. I would very specifically like to talk about what has been happening in India, because the work in India had been of tremendous importance for Ayush segment as well as and its development. First of all, the government of India had utilized the traditional medical systems of Ayush in an appropriate manner, and from a very early time in COVID-19 management, by making sure that the Ayush systems could be appropriately used to reduce the burden in the health system. All of you are aware of, because by now all of us are quite literate about this term, burden on the health system. But to give you a little bit broader understanding of how it had happened, we know by this time that Ayush systems had been a major reason, or one of the major reasons why a lot of people who would have ended up simultaneously in critical care units in India did not reach there. They had been taken care of at home, and they had been cured of the disease, even with infections, with Ayurvedic or Ayush interventions. I can also tell you, with the bold steps taken by the minister himself and his very agile secretary, I should say, Dr. Rajesh Kotecha. There had been a lot of studies which were happening across India in this regard. In fact, one of the studies I should tell you was on a large population of 80,000 policemen who were in the front line, who were working as frontline warriors of against COVID-19 pandemic in Delhi. So what happened? If you remember, or if somebody has the numbers, you can check that out. But the number of infections of COVID-19 among the Delhi police in the beginning of the COVID-19 pandemic was going up like anything. Like almost 6% was the rate of infection within the Delhi police units when in the beginning period. If you can check that out. At the same time, the entire Delhi population, it was something around 2.5%. So there was a big difference, and there were several deaths which were happening, unfortunate things. And after several discussions and and understanding with the government and with the Delhi police chiefs, the Delhi police took a decision to give Ayush remedies or Ayurvedic remedies or prophylactic measures to Delhi police personnel, and they selected 80,000 of their group of people working or of their employees, and the Ayush medicines were given to these employees on a regular basis. So it was called as Ayush kits. They were handing over medicines which would work for about or rather dosages enough for 15 days to for some people it was around 30 days. They continued this for 3 months, and they had checked it at the end of the third month, and you will be surprised to know that while the number of or the rate of infection within the Delhi population went up from something between 2 and 3% to something around 5.5% during this period, the rate of infection within the police personnel who were real friend like who were working with the COVID patients or managing the community from the friend during the situation, that rate came down from between 5 and 6%, something less than 1%, and it was tremendously appreciated. And that was one of the reasons why, or that could be only one of the reasons why, the government of India was able to publish a protocol for management of COVID, or use of Ayurveda medicines and yoga for management of COVID in mild to moderate cases, and as well as for its prophylaxis. So I was just giving you one example. I know about several of them, which I myself was part of one of the studies which got initiated in a tertiary care hospital, where we treated 60 patients. Means it was an observational but controlled trial, where 30 patients got simultaneous modern medicine drugs as well as Ayurvedic medicine, and the other group did only get modern medical interventions. So there was a considerably significant difference between the outcome. Those group which got the Ayurvedic medicines went out of the hospital by between 7th and the 10th day, whereas there was a considerable delay in the other group. So I'm just talking about one or two examples. It happened across the country. You can imagine, in Madhya Pradesh, there were 2 crore people, means 20 million people who were given prophylactic measures of Ayurveda. A similar number in Gujarat and in Kerala, when towards the mid of May and June. Between May and June, when the entire when India opened up for international flights, more than 300,000 people returned from a hotspot of COVID, which was the United Arab Emirates, back to India, and many of them had been COVID positive, and all these people were followed up with Ayurvedic medicines at their home, and in the quarantine centers. And the percentage of infections for those people who became positive was less than 1%, if you would believe it, and this is coming out as publication. So this is excellent work which has happened, and this we were able to take up to other countries also. We went to UK, and we did recently a study on we had some difficulty because it's not like India. So we had some difficulty in convincing few of the universities. So they said, let us do a pilot study, and we did a study on community-based management of COVID patients under the NHS programs, and 28 patients were given medicines of Ayurveda, Samshamini Vadi was given to these patients, and we found that in 7 days, all 28 of them, everyone, the NHS has a plan of doing COVID-19 test, RT-PCR test on the first day when you are found to be positive, and then on the 7th day it comes back for it's an automatic process of doing the test. So on the 7th day, all of them were negative. So now we are going to publish that, and that will lead to a larger study along with the London School of Health and Medicine, where we are doing a study on 2,500 patients on a prophylactic measure. So, and there are several other studies happening along with Ayush councils, as well as with the Central Council for Research and Council for Scientific and Industrial Research of India. There is a research study which is going on between Department of Science and Technology and the Ayush Ministry on the mechanisms of actions of these herbal medicines. So I think this has been a time when there was a big big revival. It was kind of a renaissance of of Ayurveda or Ayush systems during this period. So sometimes you always know, like something very very difficult. You have to be put in difficult situations when you make this big change. And I think COVID-19 had been that kind of a trigger for Ayush systems. And I'm sure that it has a lot of work to do during to reach a particular stage. But post COVID-19 syndromes are all very well managed through Ayush systems. Even though those patients who are taking medicines for management of COVID-19 come out better than those patients who are not taking like Ayurvedic medicines for COVID-19 management in their post-COVID symptoms and signs and symptoms and their health conditions. So there is a lot to be expected from Ayurveda, yoga, and in general with Ayush systems. And I'm sure that with the able hands of and guidance of the respected minister and the able within the able hands of the very dynamic secretary, Ayush would make a considerable impact in the coming years. And I'm sure that you will hear more from those people who have been directly working in this area. I had been just fortunate enough to work with Ayush Ministry during this period from March to even now. I am working and trying to help Ayush Ministry in getting all these trials and studies done. So that is my thought about how the COVID-19 period, post-COVID-19 period, will be for Ayush systems, and how it might be a trigger for a global development for Ayush systems and a better future for humanity itself. Thank you so much for inviting me over here, and it was a wonderful occasion to be with all of you. And I'm sure that this meeting is going to be of great relevance for the Indian community within India, as well as Indian community in US, as well as the scientific community in US, as well as scientific community in India, and in general for Ayush. Thank you so much.
Thank you, Dr. Krishnan.
Kanchan, are we ready?
So they're still having connection issues, so please continue with Dr. Sergio.
Okay, the next honorable speaker is going to be Dr. Sergio Lais Suarez, a colleague as a surgeon, an oncologist. He has got a long CV, so I'll make it very shorter. He has introduced Ayurvedic courses in Argentina. In 1980, he studied Vedic science in India, chairman of the Ayurvedic department in Argentina. 86, he started first Ayurvedic hospital in Latin America, Cordoba. He has received many awards. And look at his biography, he received 2 or 3 awards from my state in Gujarat, apart from getting the awards in India. One of the best things I noticed in his CV is he's also India's honorary consul general for Argentina. So welcome, Dr. Sergio Lais Suarez, and give us your thoughts about how you are able to accomplish this thing in Argentina, an exemplary example for other people to follow in other countries. Thank you and welcome.
Thank you very much, all friends from around the world. I want to thank first the Boston Center of Excellence for the invitation, and also to the Consul General of India, Randir Jaiswal, that also he was inviting me to be in touch with you today. I have many things to talk about Ayurveda and the beginning of that project in Argentina. In 1980, I went to India to learn Vedic science. That was my first trip. That is more than 40 years ago. So many years. I was there 6 months together with 23 Argentinian people at that moment. I was a medical student, and I discovered at that time Ayurveda medicine. So I realized that the most important point for me was become an Ayurvedic doctor in the future. What I did. Of course, I'm a medical doctor, traditional medical doctor. I'm a surgeon and oncologist, as the presenter say. But my main important mission is to spread the knowledge of Ayurveda in Spanish-speaking countries.
Dr. Sergio,
So,
just one quick interruption. Our Honorable Minister has joined. So, sir, welcome. Sripaji, welcome to you. And as soon as Dr. Sergio finishes, we'll have
yes. Very sorry because of some internet problem.
Yes,
I was there, but because of some internet problem. Yeah, okay. Please continue.
Thank you, sir. Dr. Sergio, please continue.
Okay. Welcome to the minister. I have a lot of things to say how we spread the knowledge of Ayurveda in Latin America. But the most important achievement, I think, was to create the first chair of Ayurvedic medicine to train Argentinian doctors and other Latin American doctors in Ayurveda medicine. That was in 1996. We created a post-degree training, theoretical and practical. And now there are in Argentina more than 7 universities, private and governmental, that are teaching Ayurveda for doctors. At that time also, I have the possibility to do something practical, and was the creation of one Ayurvedic hospital with 40 rooms in the middle of the mountains in a village called La Paisanita, surrounded by a very pristine, clear water river, where even the president of Argentina came to our center to receive Panchakarma together with their own ministers. So, but I want to talk something interesting apart of what we were doing with Ayurveda, and have to be related with the COVID-19. I was in India 3 months or almost 4 months, from February this year until the end of May. And I organized in India a protocol of medical control for COVID-19 for the Latin American people stranded in India. And I have the direct experience to check more than 460 Latin American people that were in different parts of India, basically in Delhi, in Noida, in Rishikesh, and in Vrindavan. I organized this protocol together with 2 or 3 volunteers. I include 2 or 3 embassies from Latin American countries. The Argentinian embassy, of course, that they provide a diplomatic car so we can move in the middle of the curfews. And also the Ecuador embassy, the Mexican embassy, and the Chilean embassy. And I have 3 volunteers working with me, a nurse, and social worker, and other people. And I was using a protocol of COVID-19 to see different symptomatology. And what I found during those times is that the people has several symptomatology, and I developed some kind of treatment for them. The first point that I realized that the people were lacking was the correct sleep time. Due to the quarantine, and because they were afraid they could not walk properly outside the street, they have to be in a room, in a hotel, or in a house or in a hostel, they were having bad quality of sleep. So what we did for them was we teach them several techniques to sleep better, use some medicine from Ayurveda to have a better nidra. So we realized that nidra, sleep, is a very important point to increase the immunity of the people. The second point that we realized with those people was that they were lacking physical activity. And basically to the people that are more than 60 years old, the physical activity, it is very important because it stimulates the hippocampus, this brain structure where the memory is deposited. Without activity, without physical activity, the memory of the people were decreasing. So we were teaching them yoga asanas to keep the body moving properly and keep the development of the memory in a high level. The third point that we were teaching to those people was to give to them a technique that decrease the metabolic rate, the double of the sleep. It's something that everybody knows. It is called meditation, dhyan. But not any simple meditation. Has to be a meditation that decreases the metabolic rate of the people, double that the sleep. When you are sleeping, the metabolic rate decreases in 8%, minus 8%. And we were teaching a technique called Ayurvedic meditation, medical Ayurvedic meditation, that decreased the metabolic rate up to 16%. That released the stress, increase the memory, increase the creativity of the people. Together with that, we were giving some rasayanas. The most important rasayana was Surya, sun, because today we know that the D vitamin, it is very important and we can get it for free when we are exposed 15 minutes daily to the sun. Other rasayanas that we were giving to them was Brahmi, of course, to keep the mind open, calm, and creative, and also Ashwagandha, that increase the immunity of the people. And we were giving to them also education for health. The result of that protocol of teaching and control regarding the coronavirus was including also the auscultation of the lungs, the heart, the direct vision of the throat, direct vision of the eyes to see if there is any problem in this area, and also the oxygen saturation that we were using with all the 468 patients that we saw in Argentina, in India. Also, we repeat that in Argentina. To close my speech, because it's already my time, I want to tell you that we had that direct experience to give Ayurveda medicine in the practical level and in the theoretical level to increase the immunity of the people. And that is working. Simple activities to increase the activity through yoga, make them sleep better, and increase the acne through a better digestion, because that increased the serotonin in the physiology. And when the serotonin increases in the physiology, the nervous system, it is in balance. My experience as an integrative doctor that are using Ayurveda in part of my practice, for these COVID people was excellent. We are writing now some research regarding this experience in India, and this experience that we are doing also in Argentina now since June up to now was similar to the result that we got in India. So Ayurveda works, is ready, is cheap, and there are hundreds of medical doctors that knows Ayurveda very deeply and are ready to conquer the humanity for helping the people to decrease the symptomatology of COVID-19. Thank you very much, and I appreciate your time.
Thank you so much, Dr. Sergio. So, Honorable Minister Sri Sripadji is here. Sir, welcome to our conference. We have people joined from 18 countries, and we have panelists from at least 5 countries. Dr. Sergio was talking from Argentina. So welcome, sir. Dineshji, back to you.
Welcome, Dr. Sripadnaikji. We are so thrilled that you took the trouble to come and bless this conference. Dr. Purnima is going to introduce you before you start your session. Dr. Purnimaji.
Dr. Purnima?
Can you hear me?
Please.
Yes, ma'am.
It's my great pleasure to introduce Honorable Minister Sri Sripadnaikji, who is an Indian politician and the Union Minister of State in the Ministry of Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy, which is also called Ayush. He is a Minister of State for Defense. He was the former Union Minister of State for Health and Family Welfare. He's the Member of Parliament from North Goa constituency, representing Bharatiya Janata Party. I humbly request Honorable Minister to grace this conference with his valuable remarks. Dhanyavad.
Namaskar ji, dignitaries from various esteemed universities, participants from around the world. It is my pleasure to join all of you for this global web conference, post-COVID-19 era, health and immunity impact on human and society. We all know that the world is going through a phase that our generation has never faced. The COVID-19 pandemic has spread across the world, affecting the social, political, economic, and healthcare aspect of many countries. The profound impact of the pandemic will lead to fundamental changes in our society and healthcare system. A new model of healthcare delivery with more emphasis on preventive measures is needed for the effectively countering such crisis in future. The third wave of pandemic is being faced by the many countries. The pandemic is yet to be over. We should be prepared to mitigate and manage the health issue in the post-COVID-19 era. Apart from the physical problem, this pandemic has shattered the lives of thousands of the people around the world, causing decline in mental health, leading to issues like anxiety and depression. The crisis has a far-reaching impact on human behavior also. For combating this pandemic, India, in addition to the conventional medicine, has also relied its vast experience and deep knowledge in the field of Ayurveda, Yoga, and all recognized traditional system of medicine in India and health management, including the production of high-quality, affordable medicines, equipments, etc. Ayurveda and other traditional system of medicine, by virtue of its holistic approach towards the health and disease and cost effectiveness, have an edge in dealing with health problem with primary prevention of disease. This system also have solution for combating the psychological and emotional problem arising after the pandemic. Ayurveda has been included in the National Treatment Protocol jointly launched by the Ministry of Health and Family Welfare and Ministry of Ayush. Guidelines for prevention of the COVID and guidelines for post-COVID treatment and care have also been issued by the ministry. The COVID-19 advisory published by the ministry has been widely implemented by many state governments. The ministry has trained more than 300,000 Ayush practitioners in COVID mitigation. 4 training programs on COVID through Ayush system prepared by the Ministry of Ayush are available in the iGot portal developed by the Government of India. 800,000 Ayurvedic COVID warriors are available in the COVID warrior portal and they are providing the service to the community. Ayurveda National Institute, like All India Institute of Ayurveda, New Delhi, are declared as COVID hospitals and Ayurveda treatment is being given to patients with mild to moderate symptoms. The Ayurvedic intervention has been observed highly effective. The Ministry of Ayush during the current pandemic of COVID-19 has launched 82 research projects at 112 locations. The ministry is also working with Department of Science and Technology and Department of Biotechnology to find out the molecular mechanism of action of Ayurveda medicine in COVID. The ministry is also in the process of having international research collaboration in various countries. We are looking forward to a breakthrough in the treatment of the COVID through Ayurveda. India is not only taking effective measures to prevent and treat this disease in the national context, but is also a strong supporter of joining international efforts. In the recent past, India has supported many countries in their fight against COVID through supply of Ayurvedic medicine. I'm sure that the Ayurveda, yoga and other systems will be greatly helpful for the entire world in dealing with post-COVID difficulties. I wish this global web conference a grand success. Thank you very much. Jai Hind.
Thank you. Thank you, Shripadji, for taking the trouble on a weekend. I know you're so busy dealing with COVID. Thank you so much for joining us and for your gracing this event.
Thank you.
So, this session ends, and we are going to move to the next session. So, Dineshji, your remarks, closing remarks, please.
This is it's difficult to summarize the wealth of the knowledge from all the wonderful people. But what I see, the golden mission of BoCE was how to heal the hurt. And we accomplished this goal. I think with the public, private, state, federal government, academic and scientist partnership across the globe, it has made it possible for us to accomplish the goal of how integrative medicine can help in healing the hurt. The state government, federal government, WHO, scientists, academicians, global countries, especially the excitement and real true commitment coming from Indian government and Ayush Ministry has really helped us promote the idea of how integrative medicine can heal the hurt. So public, private, academic, scientist partnership can accomplish this objective. So thank you all the panelists for providing this wonderful information that it is possible post-COVID-19 that by working together, this is possible and we can heal the hurt much faster, not just from COVID, but even from other aspects. Mind, spirit can make a huge difference. So thank you again, all the panelists, for taking the time to provide your knowledge to global citizens. Thank you, and we'll start the next session.
Thank you, Dr. Patel, and all the panelists. Before we start the next session, I believe Haimanti should be here. Haimanti, are you there? We don't. Do I see you? Okay, we see you. So, before we go to the next segment, I just wanted to share quickly what the Boston Center of Excellence is doing. BoCE, fondly we call it, Boston Center of Excellence for Health and Human Development, is established to bring together researchers, subject matter experts, practitioners, institutions, and supporters to foster research, program development, education, training, and promotion of yoga and Ayurveda. And we are doing it for the last 5 years, and we have the blessings from the Ministry of Ayush, and Honorable Minister has also attended our event in the past, and we are thankful for all the support from the Government of India and Ministry of Ayush. The center aims to improve disease outcomes by making yoga and Ayurveda core constituent of integrative health and medicine in the US and worldwide. And Dr. Sergio actually mentioned that modern medicine doctors could help many more people, the patients, by using some of the ideas he presented relating to yoga and Ayurveda and other forms of traditional medicine. So with that, thank you very much, and requesting Haimanti to take charge for this session as a host.
Oh, let me check. I cannot see myself. Okay. Namaskar. Good morning. Good evening. I am your host for the next session, this session rather, Impact and Future of the Healthcare in Post-COVID-19 Era. And before I introduce myself, quickly I want to say a couple of things. That I want to re-emphasize what all these esteemed panelists said before, that we have lots of pros and cons due to this COVID. And as the whole world got hit really very badly, severely by this deadly pandemic, and we lost hundreds of thousands of people worldwide, and economy rattled badly. But the cons are here also. So that this is the time to pause. We had a pause in our life to contemplate that what we can do even better, and deep down to the ocean of knowledge and bring up our ancestral knowledge, like knowledge of integrative medicine, natural medicine. So my name is Haimanti Banerjee. I am a technology expert at Boston Children's Hospital and in quality and safety. I am a founding member of Boston Center of Excellence of Health and Human Development. And I am a yoga teacher. I am very much passionate about yoga. And with that, it is my honor and privilege to introduce Dr. Sadhvir Khalsa. And Dr. Sadhvir Khalsa, it is great to see you, Dr. Khalsa. And he is an assistant professor of medicine at Brigham and Women's Hospital at Harvard Medical School, director of yoga research, Yoga Alliance. He is doing humongous amount of work in this domain, and we are already startled with his work every day. He is also editor-in-chief in International Journal of Yoga Therapy. Over to you, Dr. Khalsa.
Thank you very much for that kind introduction, and I want to thank the conference organizers for the invitation to chair this session of panelists. And so I will go ahead and begin sharing my screen. And so the topic of this panel is impact and future of healthcare in the post-COVID-19 era. And we have in this session three panelists: Dr. Ravi Ramamurthy, Professor Bhushan Patwardhan, and Dr. Rama Jayasundar. And so I will be speaking for 10 minutes, and each of our panelists will then be speaking for 15 minutes. And we are hoping to take questions from the attendees. So please, if you have questions during the presentations, please enter these questions into the chat box, and we will entertain these after all four of the speakers have concluded their remarks. So without further ado, I will go ahead and begin my presentation. And my expertise, as noted, is really in the field of yoga and specifically yoga research. And so I will be addressing the relevance of yoga in both the current COVID situation and potentially the post-COVID era. But before I launch into those specifics, I wanted to sort of review where we stand with our understanding of how yoga works from a psychophysiological perspective in terms of its effects on the mind and on the body. Now, of course, when we're talking about yoga, I'm really talking about traditional yoga practice, which is not just the postures and exercises or asanas, but also very importantly includes the breathing practices or the pranayama, deep relaxation techniques such as shavasana, yoga nidra, and very, very importantly, the meditative component, aspects of single point focus, open focus meditation practices. All of these practices independently have been shown to affect the physical body in what I'm calling fitness. That improves things like flexibility, strength, coordination, balance, respiratory function, which leads to improvements in psychological self-efficacy. All of these practices also over time improve self-regulation of internal state, particularly and most importantly on stress regulation and emotion regulation, which over time in practice leads to the characteristics of resilience to stress and equanimity in the face of emotional challenge. It's largely through the meditative component that we are increasing our mind-body awareness, also now internationally known popularly as mindfulness. This is through engagement of the attention networks in the brain, which also improves cognitive functioning, concentration, and over time these practices lead to a state of metacognition, the ability to self-regulate thought processes in the mind. Also through the meditative component, and this typically occurs over a longer period of time, typically months and years, people start to experience these unitive states during the meditative practices, which leads to experiences of transcendence flow. And many people experience a deeper transformation, a change in life meaning and purpose, a change in life goals. People will say things like, yoga changed my life. And we have very good scientific evidence for most of these characteristics, especially the fitness component. Of course, these are very objective measures. These are easily measured. But over the past 20 years, we've seen modern scientific technology applied to our understanding of self-regulation and mind-body awareness in yoga practices. And as you can see from many of these improvements in characteristics, automatically there is relevance to the COVID epidemic and certainly to post-COVID, the post-COVID world. Because we're making changes across such a broad spectrum of human functioning, we're seeing changes in global human functionality from the gross levels, from the physical body, to these skill sets of emotion regulation, awareness, mindfulness, and metacognition, to these deeper experiences, what I'm calling pure spirituality. So I want to address yoga with respect to COVID and post-COVID in three realms. First of all is the benefits in mental health, the relevance of that, the relevance to disease resistance, specifically in communicable diseases. And then I also wanted to address the topic of chronic disease, so-called non-communicable diseases. So looking at mental health, of course, when we are experiencing any kind of challenge in society, and certainly a pandemic is exactly such a challenge, the levels of chronic perceived stress increase dramatically. And in fact, we have evidence of this. The American Psychological Association has conducted surveys during the pandemic showing the increase that the pandemic has caused in terms of perception of stress. And stress, of course, leads to many, many consequences. It's a major risk factor for many disorders, especially mental health conditions. And yoga is, as we've noted in our logic model, is very effective at reducing stress, reducing perceived stress, and enhancing resilience to stress. Another feature, of course, that comes from stress, which is a major risk factor, is mood disturbance. People start to experience anxiety, depression, a number of other conditions, and these can lead in turn to other mental health conditions such as substance abuse. So in reduction of stress, in improvement in regulation of emotion, and particularly the establishment of metacognition, yoga can be very helpful in managing this mood disturbance and preventing that from becoming clinically significant. And then finally, in any pandemic, of course, we have experienced hundreds of thousands of deaths. This is challenging our sense of life purpose and meaning. It's challenging our sense of core, who we are, what our relationship is to the planet. And these deeper experiences of yoga practice can really give us a sense of life purpose and meaning that can allow us to cope more effectively with such a deep and universal challenge to humanity as a whole. The next topic I want to address is disease resistance and how yoga can work directly in that. And first of all is our ability to change and enhance our immune function. There is a field that is now well established called psychoneuroimmunology. And one of the major findings in that field is the strong and very real role of chronic stress in impairing immune function. And so one role that yoga can provide is to buffer that change in stress to keep immune function high. It is also possible, although we don't have evidence yet, that these yoga practices may be directly stimulating immune function. But right now, the evidence is really strong, certainly showing that people under chronic stress have impaired immune function and that yoga can restore that immune function. So this is very important in any kind of pandemic of a communicable disease. Dr. Suarez mentioned sleep. And this is not yet well known in modern medicine, but sleep researchers now have very convincing evidence that lack of sleep or short amounts of sleep has a direct and immediate impact on immune function in a negative way. In fact, this impairment can happen even after just one night of sleep loss. In modern society, we have two situations which are reducing the quantity and quality of sleep. One of these is intentional sleeping short. 1/3 of the population in the United States, for example, sleeps less than 6.5 hours per night on average by intention. And this is a misunderstanding of the need for sleep and its importance in behavior and in health. Another factor is chronic insomnia. About 30% of the population routinely experiences sleep disturbance, which can also impair the quantity and quality of sleep. So yoga can reduce the stress-induced factors that underlie this insomnia. I believe that the awareness that's generated by yoga practice can also induce a change in behavior. That people, when people practice yoga, they become more aware and sensitive to their body's needs, and therefore may apply more respect to their body and get more sleep. So this can be also an important factor in improving immune function during disease. Another facet that yoga can provide is actually changes in behavior. And one of these changes in behavior can come from this increase in mind-body awareness. If you increase your mind-body awareness and your sensitivity or your mindfulness, you are therefore more sensitive to your behavior. That can make you more compliant with hygienic behaviors in something like a pandemic of infectious disease. In fact, there has already been a study before the pandemic in which they applied a mindfulness intervention to medical professionals and examined the degree to which they were conducting basic hand hygiene of hand washing, and showed that the mindfulness intervention could enhance their basic behaviors with respect to hand washing and hygienic behavior. Another behavior, of course, that's come up with the pandemic is some individuals in society refusing to wear a mask and refusing to respect others' vulnerability to this disease. And I think the spirituality aspect of yoga can possibly generate changes in individuals' positive psychological states, specifically things like kindness and compassion. And people with more kindness and more compassion will be more tolerant to accept behaviors that they know can help others avoid this disease. So that's another indirect way in which yoga can enhance disease resistance. And finally, although I didn't show it in the model, another practice within yoga is some of these so-called shakriyas. One of these is known as jalaneti. This is a nasal wash of warm salt water through the upper airway passages. And many yoga lifestyle practitioners will engage in this practice as a routine hygienic practice. There's really remarkable research that has been conducted, and this was done before the pandemic, showing that nasal washes can reduce the severity and the duration of coronaviruses. In fact, this was published in one of the Nature journals, and the mechanism is now known, showing that the chloride in the salt actually enters the cells, binds within agents within the cell to create the effective agent in bleach, and thereby reducing the viral replication within the cell. So jalaneti can be a very important facet in terms of dealing with an active upper respiratory tract infection, which of course COVID is as a coronavirus. The final issue I want to address is really chronic disease. These are so-called non-communicable diseases. These are lifestyle diseases, things like cardiovascular disease, type 2 diabetes, etc. These are due to lifestyle, negative lifestyle behaviors, particularly sedentary behavior and poor dietary control, negative behaviors such as excessive alcohol consumption or smoking, and then I would add to this chronic stress. These are the major risk factors for chronic disease, which create this epidemic which we are now facing. This is truly an epidemic, but many people have actually calling this a pandemic because it is really worldwide. This is responsible for 41% of all deaths, 41 million deaths worldwide. And between the ages of 30 and 69, it's responsible for 15 million deaths annually. Now, as we know, the vulnerability to death from a COVID is due in large part to a secondary underlying condition. And many of these underlying conditions are these so-called chronic diseases. So if we can reduce the burden of chronic disease, we can reduce the vulnerability, particularly in the elderly who have these secondary conditions, and reduce the percentage of these secondary conditions, and thereby enhance survivability in those elderly populations. And then my final comment is really sort of more post-COVID focused. Given the relative morbidity of these diseases, if we're talking about 1.5 million deaths so far, perhaps, with the COVID epidemic, that pales in comparison to 41 million people dying annually. And yet, when you watch the news on television, the statistics are all on the COVID deaths. And the NCD epidemic has faded into the background. And I think it's very important that we come back and address the NCD epidemic post-COVID, because this is really the greatest burden in the healthcare internationally. And I think that yoga is well positioned to address the risk factors for chronic disease because of those aspects in the logic model of reducing sedentary behavior, of reducing chronic stress, and increasing mind-body awareness, which can be very important in changing dietary behaviors, another risk factor for NCDs. So with that, I will stop sharing my screen, and and take us back to the other presentations that we have. And our first speaker is Dr. Ravi Ramamurthy, a distinguished professor of international business and strategy and director, Center for Emerging Markets at Northeastern University in Boston. He's a fellow of the Academy of the International Business. He has been a visiting professor at Harvard Business School, Massachusetts Institute of Technology Sloan, CEIBS Shanghai, IMD Lausanne, and the Wharton School. So Dr. Ramamurthy, I invite you to begin your presentation.
Thank you. Shall I share my screen?
Yes, please, whenever you're ready.
All right, just give me a second. Okay, thank you, Dr. Khalsa. I hope you're able to see the screen. I come at into this conference as a bit of an interloper, I think. I'm not a person who has actually worked on traditional medicine or yoga, although I've been listening with great interest because these are obviously very important ideas and practices that the West can learn from the East. So, but that's a theme I have been studying in a more contemporary context. And I'm going to speak today to some of the lessons that I think the West could learn from the East in terms of fighting COVID. I didn't realize this, but there is in fact a connection between the work have been doing for the last few years and the topic of this conference, which is mainly looking at the contribution that traditional Indian medicine can make towards the well-being of people everywhere on the planet. Let me introduce this notion of reverse innovation that I've had some role in contributing to the management literature, and that is the idea, in a sense, of the West learning from the East. And of course, I'm oversimplifying when I use the terms West and East. I'm referring really to the developed or the rich countries and equating them with the West, and the relatively poorer or relatively less developed countries, which I'm equating to the East. But if you look at what, at least in the last 2 centuries since the Industrial Revolution, most of the ideas or innovations have gone from the developed countries to the developing countries. Every developing country is on the lookout all the time for ideas that they can borrow from the developed countries in order to speed up their growth. And we see so many examples of that. It doesn't require any elaboration. But reverse innovation is just the idea of innovations going in the opposite direction. We call it trickling up because it sounds a little counterintuitive. What can the developed countries possibly learn from the developing countries? Of course, to this audience, that must seem like a preposterous statement. Certainly, traditional medicine is one of those contributions that India has made, and China has also made with traditional Chinese medicine. But many, many other contributions have come out of these countries. Think of the contributions from India and China on so many scientific, technological matters before the Industrial Revolution. All we're saying is we're now entering a phase in which probably we're going to see many more contributions coming from these developing countries to the developed countries, if the developed countries are in a frame of mind to be able to absorb and learn from other countries. Now, I applied this idea in the context of healthcare and wrote a few articles in the Harvard Business Review and a book published by Harvard Business Review Press. But this is very contemporary and it's modern medicine. And it's saying that in countries like the US, where healthcare costs are spiraling out of control, where quality is often uneven and access is less than universal, and yet, country spends 18% of its GDP on healthcare, truly innovative ideas on how to deliver healthcare, not the science behind healthcare, but how to deliver healthcare efficiently, faster, cheaper, better, which I think is a theme we're probably going to hear a lot today. Those ideas can actually come from countries like India, and that was the basis of this project.
Dr. Ramamurthy, do you mind doing a slideshow, because we see your screen small? So if you do a slideshow,
okay.
increase it. Thank you.
Yeah. Does that help?
Not yet. Yeah, that's better.
Yeah.
Thank you.
All right. Yeah. So this was in the context of elective surgeries, really, where hospitals in India like Arvind Eye Care and Narayana Health have done some very interesting, developed some very interesting practices on how to provide high quality care at very, very low costs and expand access at the same time and do so in a profitable and scalable and sustainable fashion. So that was the theme of that work. What I didn't realize was that in the context of COVID, there was also opportunity for countries like the US to learn from developing countries. And it began to dawn on me as everyone else, every citizen, looking at some of the stories and facts coming out of different countries after COVID hit. And I remember sometime in April starting to see these numbers about death rates from COVID in deaths per million population in different countries. And you can see that in this table. This is as of May 2020, that the death rates, even at that time in the US, was about 300 per million population. And it was 0 in Vietnam. Now, Vietnam has 100 million people, which is 1/3 of the US population. It's next door to China, economically very interdependent with China, and has therefore a lot of people going back and forth. And yet, at the time of that reporting in May, Vietnam had 0 deaths. And you can see in the table, many countries in Asia and Africa had single digits or less than even 1 death per million, whereas it was in the triple digits in most of the countries in the West. And there was a lot of discussion in the US about how the US is doing better or worse than Italy or UK or Sweden, or is Sweden better than Denmark? But they tended to miss the fact that they were all much higher than any of these countries that you see on the right side of this table. And I was puzzled by this. And I don't think it's all because of underreporting of statistics of deaths and infections, or because of some of the other explanations that you might initially think of, such as there are demographic differences, or there are climate differences, or there are geographic differences, or even political system differences that allow these countries to contain it more effectively. I don't think those things I didn't find them very convincing, because on all of those variables, these countries on the right side of the table are pretty heterogeneous. They're not all alike on any of those dimensions. So I thought it was interesting to ask, what might the US or other countries in the West learn from the experience of fighting COVID in these countries? So I wrote a piece for for Harvard Business Review on how we might be able to use reverse innovation in the fight against COVID. And at that point, I thought, in order to make the argument more convincing, I should look for actual examples. Were there actually any examples of US organizations actually learning something from another country, a developing country or emerging economy, and then being able to apply them in the US? And I found 2 examples, and I wrote about those examples in that article. So take the area of testing. We see on the left, you see this picture of all these cars waiting for drive-through testing. This is in Miami, I believe. But this idea of doing testing with people still in their cars actually originated from Korea. And they came up with this when they had the earlier rounds of epidemics, such as SARS and MERS. And very quickly, this idea spread in the US. Now, that's great, because we don't need to reinvent the wheel. But there was another idea or another situation, like the one you see on the right, where if a hospital is located in an urban congested area where you can't have people driving through, what do you do? Well, Mass General Hospital had exactly that problem, and they were using a specified portion of the hospital to conduct these tests. They would do 3 tests in an hour, because they had to change PPE. They had to clean the room before they could bring the next person in. There was always concern also that the medical staff might get infected. Well, a hospital in Korea had invented a pressurized booth as a solution to this problem. And you can keep the medical staff, isolate them from the people whose samples you're taking. And you can now do a test in about a minute per patient, and you don't need PPE, and there was almost no risk of getting infected. So Mass General said, why don't we see if we can use this, produce these kinds of booths? They contacted the hospital in Korea. They learned a few lessons. They improved on the design. They modified it in certain ways. And the picture you see on the right is one of the booths that they developed and that they then used across 9 locations in their network, and is now being produced in the US by a company and making it available to other hospitals across the US. Now, this I thought was an interesting example of an idea actually traveling from a developing country, or Korea is a pretty developed country, but it's not. I know the US is at least as developed on many fronts, and not more so, and certainly is higher per capita income than South Korea. So it benefited from this innovation. And I found a second example in the area of contact tracing by state of Massachusetts, which is one of the first to have a statewide contact tracing system. Now, this looks very basic if you're coming from one of the developing countries. If you're from Africa, contact tracing is very much part of the repertoire and very widely used and well-established practice. But it was a practice that had atrophied in the US and was not ready to be carried out on the scale required when COVID hit. So Massachusetts set up a system to do this. And the interesting thing for me was they brought in as a partner, Partners in Health, which has several years of experience doing human contact tracing in Africa. And they brought some of the practices that had worked there, a key part of which was that you had to have a direct human-to-human connection between the infected person and the public health system that was going to provide guidance to that person on how to take care of themselves and prevent the spread of the infection. You couldn't just do this with apps. You couldn't just do this with technology. You actually had to have a human being doing this. And so they set up a system, they set up the protocols and helped Massachusetts with that process. Now, having done this, it struck me that maybe there are many other areas in which the US and other countries could learn from the countries that had been more effective in fighting COVID. So we launched a project in my center called Reverse Innovation to fight COVID-19. And we scoured the internet and looked through everything and anything we could find on countries that had been particularly effective at fighting COVID-19. And we created this resource with the intention of crowdsourcing more ideas. And, we found about 50 actionable ideas that we thought these countries had used that could be borrowed and applied by the developed countries, including the US. And if you're interested, please visit the website for more details on what these ideas are. And as a result of creating the website, we've now been getting more leads and ideas from other people that we have in the network or people who visit the website. So then I wrote a follow-up article in our business review on how global crowdsourcing can help the US beat the pandemic. We're trying to sum up what did we learn from this exploration, what other countries had done to fight COVID effectively. And I don't want to walk you through all of the things that we discovered, but I just give you a flavor for the kinds of things that we discovered. First is that, don't misattribute the success of those Eastern or African countries to things like climate, demographics, geography, population density, political system, and so on. And don't assume that developed countries have nothing to learn from developing countries. That's a mental block very often, and I'm sure it comes up in the context of traditional medicine as well. There is a tendency to dismiss ideas coming from less developed countries, even when there is a long traditional history of success with certain practices. So we need to be more open-minded was one of the conclusions. Second, countries that fought COVID effectively, we found had a multi-pronged, so they used the full toolbox and not just lockdowns or not just relying on treatment. And they had a national level strategy, and the goal was to crush the pandemic. It was not to contain it to medically manageable levels, which was, I think, the approach in the US. How can we flatten the curve so that we don't have more people falling sick than our ICUs can handle? That allows you actually to allow the infection to spread even more than it should. And certainly more than it would if you were a poor country, which just didn't have very much of medical capacity to handle people who are sick. And therefore, you go all in on prevention and not rely on treatment to take care of the problem. So that, I think, is an area in which the US has fallen really short. And right now, particularly as we see the infection spreading at very high rates, is very troubling because speed and responding quickly and trying to crush the first few cases, it has to be part of the repertoire for dealing with this problem. Another takeaway for us was simple ideas actually go a very long way. And the masks is a great example, but we have many other simple ideas these countries used. Communicating to the public, setting a proper example, creating a command center, and then augmenting some of these practices with technology seems to also help, whether it's technology for digital contact tracing to support human contact tracing, or electronic fencing as a way of allowing people to quarantine at home, having regular using robots and drones and so on in some simple ways to either monitor crowds or to disinfect spaces. But then nothing very, very fancy. It's really very basic, simple ideas that go a very long way. And a reminder that sometimes if you're not so developed and you're not so if you're resource constrained, you actually gravitate towards simple solutions. And as I hear Dr. Khalsa talk about what yoga can do for you, I mean, it doesn't cost anything, right? It doesn't require any equipment, doesn't cost anything. And so it's actually very often these solutions coming out of the developing countries are simpler, cheaper, faster. Simpler, cheaper, faster, and often more effective. So why would you not want to consider them as part of your solution? And finally, we thought some experiments going on around the world on how to fight COVID, different areas in prevention, testing, quarantining, treatments, vaccines, and all countries should be able to learn from each other, and certainly the US should be able to learn as well. Sorry to say that this is the data as of yesterday on the death rates from COVID. And as you can see, in East Asia and the African countries that we looked at, it's still at a very low level. And so it's an order of magnitude higher in the more developed countries, which is paradoxical. You would think the more developed countries are better equipped to deal with something like this, but in fact, they have not proven to be that way. So I guess I will go back to the general theme that I hope is relevant to this conference, which is the West can learn from the East. I'll stop with that and hand it back to you, Dr. Khalsa.
Thank you very much for that very enlightening presentation. Very well received. Thank you so much. We'll move right on to our next speaker, Professor Bhushan Patwardhan. He's an eminent biomedical scientist who has made original contributions in evidence-based Ayurveda, especially in Ayurvedic biology, ethnopharmacology, natural product development, and public health. He is founding editor-in-chief of the Journal of Ayurveda and Integrative Medicine, published by Elsevier. Dr. Patwardhan, the platform is yours. Please begin.
Yeah, thank you, Dr. Khalsa. I hope you can hear me and see my screen.
Yes, we're fine.
Yeah, thank you. And let me thank BoCE Center of Excellence and Kanchanji, Hematiji, Balramji, the whole team of BoCE Center. It's good to get connected, although virtually. I will be talking today about different. I will not speak about my own research or what Ayurveda research has happening in India during COVID that Dr. Geeta has covered to some extent. But I will because the session is on post-COVID, I will try to really discuss a particular question, and my question is it now right time actually to transit from pathy-based system to people-centered holistic healthcare? And this question I will raise again at the end, and I would request all the delegates who are there in the chat box to give answer yes, no, or no comment. I'll start with the COVID pandemic adversity and the opportunity for healthcare reforms it is creating. I think that today we are living in a medicalized society, where availability, accessibility, affordability of healthcare, what we call it as healthcare, is becoming very challenging, and we are by and large driven by market forces, and our focus has been on curative practices. On other side, if you look at the slide, I have put some that the essence of message from this slide is, while the evidence of science or scientific studies or R&D is increasing, on one side, on other side, commercialization is also increasing, and on the other side, the value systems are going down. The ethics values are going down. So evidence is going up, ethics is coming down, which is also a worrying situation. And the conference theme also talks about impact on human and society. And so I thought of bringing this slide. I think the root cause of all this is between need and greed. While the world is moving towards minimalization, actually Mahatma Gandhi told us the same thing. On the other side, there is a greed. If you take examples of the cost of drugs which are coming up with exorbitant reach of the rich people in rich countries also may not afford these treatments, So this, we are asking a question, global good over profits, is this the way ahead? And where is health in healthcare? That is my next question to all of you. Are we really talking about healthcare? Because healthcare is primarily about primary healthcare, family medicine, health promotion, and disease prevention. We are actually in health, not in healthcare, but in cures business, which is about hospitals, surgeries, drugs, and diagnostics. But we are not even limited to now cure, because even if we restrict ourselves to cure, very focused, that's also fine. But now we are moving actually in creating some kind of a health scare. We are actually scaring people, and today's business is based on how much you are able to scare people. And look at some of the advertisements which we see on local newspapers, And if you have high blood sugar, so much of danger, you may have risk of end organ failures, you may have risk of amputation and things like that. And look at the sample prescription which I have put on the screen. This is a prescription given to a 70-plus-year-old lady, and her problem was she was having just simple flu. And she was having so much of nausea that she said that what I'm going to do with 8 drugs which are prescribed to me. So what are we doing? Medical doctors at one point of time were looked at God. In India, we still look to them as gods. They should be health guardians and not drug prescribers. And all medical doctors should know about primary health care. They should be good family physicians as gatekeepers, And disease prevention and health promotion, they should also look into, not just treatments, and public health sensitivities they should have. They must be conversant with the basic determinants of health, whether it is genetics, nutrition, lifestyle, environment. How much of this we are actually teaching in medical schools? That is my another question. So these 4 determinants of health, which are like 4 pillars of any building, when they get weakened, you need a support system, and this support system is medical care. But we are considering medical care as a mainstream today. And in the process, what we have done is the patient has become extremely gullible and is getting trapped into diagnostic labs, doctors, drug companies, hospitals, insurance companies, and so on and so forth. So where are we heading? The COVID is actually has given us an opportunity to take a pause, as was mentioned earlier. I think our health in our hand, or your health in your hand, should be our motto. The community empowerment for health is necessary. And I feel that health is very precious to be outsourced to doctors or hospitals. Doctors and hospitals are extremely important when we lose health, but keeping health intact in our hand is actually in our hand. And scientists and doctors should empower community and empower people to help them to keep that health in their own hands. People need simple ways to achieve health and prevent diseases. People need healthy diet, healthy lifestyle, mental peace and relaxation. They need primary care, they need emergency measures, or surgery, things like based from allopathy, and holistic and preventive aspects which can come from Ayurveda and yoga, which we call it a Ayur Yoga club together. So essentially, we need health assurance and not necessarily health insurance. Health insurance is not sufficient for people. People need health assurance. And we should move from medical care in which we are today in, which is about sickness, illness, drug-centric curative approach, to preventive care, which is more based on prognosis and lifestyle management. And slowly we should really move to real healthcare, which is about public health and personalized medicine, which is person health, wellness-centric integrated approach. And this integrative medicine and holistic care, I think, is evidence-based practice as well as practice-based evidence, because Ayurveda or CAM practitioners are also full with a lot of experience. So on one side, we need experimental evidence. On the other side, we also want experiential evidence. And so biomedical sciences, bringing from physics, chemistry, engineering, omics technologies and all are also necessary. Modern medicine is also necessary, which brings in modern diagnostics, therapeutics, super specialized and surgeries. And by the way, diagnostics should not be considered as monopoly of modern medicine. Ayurveda, yoga, everybody, traditional medicine, they also should have access to diagnostics. So if we are able to really look into the whole and see what patient need and try to transit from current pathy-centric approach to patient-centric or people-centric approach, we need to ask again this question, traditional and modern. I feel that modernity is evolving tradition. I mean, at one time, modern medicine was Greek traditional medicine. They walked along with the modern science and became modern medicine. Whether we want food or medicine is the question. Whether we are going into nutrition or supplements. Now, supplements are coming in a big way because discovering drug has become a problem. So people are going in more and more in easy ways to get health supplement. Family chats or mobile apps, living rooms or home theaters, home kitchens or home delivery systems, consumerism or minimalism, illness or wellness. Transition from pathy-based curative approach to person or people-centric holistic healthcare. Focus on primary and social determinants of health, focus more on wellness and swasthya concept, focus more on immunity and inflammation, that's what COVID is all about, focus more on family care and primary care, focus more on nutrition, behavioral and mental health, community empowerment, your health in your hands, and Ayurveda and yoga essentially integrated with modern medicine seem to be the future. So I would like to again put this question back to all of you, whether it's time to transit from pathy-based approach, which is more of a war of turf, to people-centered holistic healthcare. And I'm going to put this with a link to my recent editorial, which expands some of the points which I have made in the chat box. And I would appreciate if all of you would take some time to respond yes, no, or no comments. Thank you very much. Some of the thoughts which I have presented have come through my book, which I have written with Dr. Gururaj Mutalik, who is in US, at present, Integrative Approaches for Health. Thank you, Boston Center for Excellence, for this opportunity. Thank you.
Thank you. Please put the link on the chat box.
Yes, please enter any questions that you may have for speakers in the chat box. Thank you, Dr. Patwardhan, for an excellent talk on the topic of integrative medicine and its future and role in modern medicine. Let's now move on to our final panelist speaker, Dr. Rama Jayasundar. She is the professor and head in the Department of Nuclear Magnetic Resonance at the prestigious All India Institute of Medical Sciences in New Delhi. She's an expert on the science behind Ayurveda. She has a PhD in physics from Cambridge University. She also has a medical degree in Ayurveda and is a professionally trained Ayurvedic doctor. Dr. Jayasundar, please begin whenever you're ready.
And your video is not on. If you please turn on your video.
Yep. Yes.
We can see you now. Thank you.
Screen share, please. I would like to share my screen.
You can use the icon in the bottom that shows a screen and arrow. Are you going to use PowerPoint?
Yes, I have a PowerPoint.
So choose application and then PowerPoint.
Choose application. Just hold on for a minute. I'm not getting the application. No, I'm not getting it.
Application window.
No, I'm not able to see the application window.
Have you clicked on that box with arrow in the bottom?
No, I am not able to see that. There is no box with the arrow.
Hold on 1 second.
There should be 6 icons at the bottom of the screen, and the fourth one from the left shows a little bit of a small monitor with a little arrow in it. That is the share screen.
Just in case, can you just quickly email to us, me, if you have my email address? Just
no, because I am clicking it and it's not, getting activated.
So, are you able to see the start screen share button?
It doesn't. I mean, there is this button with it only says switch camera.
No. So, can you please quickly email it to me?
Email it.
This is Kanchan, forkanchan@gmail.com.
Okay.
And I'll share it for you.
Okay. Why am I not able to see the icon?
Don't know. We tested it fine last time, but I don't know what happened today.
Yes.
Okay. But just email to me. I'll share it for you.
Okay. Just give me a minute.
Yeah. And in the meantime, Dr. Khalsa, you may add some more comments on this session.
Well, perhaps we can take one of the questions in advance. We have one question in the chat box from Dr. T.V. Gopal from Anna University in Chennai. The question is, what is low cost in traditional Indian medicine? My answer, minimal use of materials. Is the total cost for healing comparable with other methods for healing? So I invite either of our panelists to answer that question.
Maybe Dr. Patwardhan?
No, I agree what you said, material as medicine, we should reduce to whatever possible extent, and physiological interventions actually are important wherever we can.
This is, I don't know why she...
I can perhaps elaborate on that answer as well. I think that modern medicine really has focused on something that has been historically very useful, which is high technology. We have fantastic surgeries. We have wonderful high technology. The problem is that when these high technologies are applied in inappropriate places, they may not work well. And I think with the major burden of modern disease being non-communicable lifestyle disease, these technological solutions are somewhat inappropriate. In other words, the cure for type 2 diabetes is not a pill. You cannot, I think, cure an epidemic of type 2 diabetes with a pill. So I think this is the problem, that this investment in high technology is important for certain circumstances, but inappropriate for others. And given the biggest burden in modern medicine being lifestyle disease, what we need is behavior change. And that cannot be established so easily with these high technological approaches. So that is why in the US, for example, we have such a high burden of cost, and yet relative to other countries, we are not experiencing an improvement in total longevity.
Yeah, it is sent. The PPT has been sent.
Yeah, I'm Dr. Jayasundar, waiting for the presentation. It hasn't reached yet. So as soon as it is here, we'll share it. But in the meantime, you can speak probably. Just as you can speak in general, and then we can, as soon as the PowerPoint is available, we can share it.
Yeah. Okay. So I have already sent the PPT. So let me